everyone, this is Dr. Salcedo, your conscious gynecologist. I'm so glad you're here. Today we're going to be talking about why it's so hard to treat endometriosis. Now, endometriosis, it's just turning into one of my favorite topics because there has been so much improvements in what we know and how we can treat endometriosis that doesn't always involve medications and surgery. There's so much investigative research that I can't wait to share with you as the videos go on. Today's topic about how hard it is to treat endometriosis, why it's so hard, is going to list 5 different reasons why it's difficult. So if you're interested, go ahead and subscribe, go ahead and like this, share it with a friend, and let's get to it. Why is it so hard to treat endometriosis? Endometriosis is actually a really common, unfortunately common disorder. About 1 in 10 women will have symptoms of endometriosis. And, honestly, the way that we diagnose endometriosis is kind of archaic. It leads the doctor to only rely on surgical diagnosis to make the gold standard bona fide diagnosis for a lot of women. And that is really challenging and it uses a lot of resources, but it's also a little bit of a risk for women to have to undergo surgery in order to get a diagnosis. So the number one reason why it's so hard to treat endometriosis is because there's just no good theories. There's several different theories that we learned in medical school about why endometriosis comes to be. Is it lymphatic spread? Is it something called coelomic metaplasia, when basically the cells of the lining of the pelvis just somehow convert into endometriosis? Or is it actually my favorite theory called retrograde menstruation, where the cells of the lining of the uterus, not only during menstruation, come out through the vagina, but they also come out through the fallopian tubes. It's called Sampson's theory of retrograde menstruation. But then what happens after that? Everyone has retrograde menstruation. So what is it about these 10% of women who end up getting endometriosis? Well, what we know and what we've been learning in this channel is that endometriosis tends to associate among women who have gut microbiome disturbances. Now, gut microbiome, that is a collection and an environment of healthy bacteria for us humans that live in our intestines that provide immune protection, they provide barriers for toxins that come into our body, and they are actually a source of certain vitamins that we need to have normal immune processes. Now, if the gut microbiome is disturbed, then that leads to leakage of inflammatory molecules into the pelvis, down, into the space between the rectum and the uterus. When that inflammation comes to be, then those retrograde menstrual cells, the cells that leak through the fallopian tubes, implant into the areas that are inflamed, and then reconnections, neovascularization between the cells of the menses and the peritoneum, the pelvis, they start to reconnect, and then those cells, those menstrual cells, are activated and receive the signaling of estrogen and progesterone and bleed just like any other menstrual cell in the lining of the uterus, but they're bleeding in the pelvis. And that's why it's so uncomfortable. That's why so many people have this bloating. And so the biggest reason why it's so hard to treat endometriosis is because there's no good theory, and that so many doctors are not aware of the gut microbiome connection between endometriosis and the disturbances of the healthy bacteria that make us human. Now, number 2 reason why it's so difficult to treat endometriosis is because everyone's symptoms are so different. You could have bloating, you could have constipation, you could have pain on your menstrual cycle. You could have pain that's not controlled with birth control pills or even regular pain medications. You can have heavy periods, but not everybody who has heavy periods has endometriosis. You can have maybe some perirectal pain while you're on your menstrual cycle, or when you defecate or have a bowel movement on your menstrual cycle. It might be painful. You might have diarrhea during your menstrual cycle or constipation. You may have pain if you sat really quickly while you're on your menstrual cycle. And you also might have some pain with intercourse as the penis is going to the back of the vagina. It might be hitting on some spots that have some endometrial implants. And really, it just takes so dang long to get a diagnosis. A lot of women will see 5 to 7 doctors to actually get a diagnosis of endometriosis because of these very non-specific symptoms that are related to all of these gut and intestinal inflammatory syndromes that happen as the initial root cause of endometriosis. And so that's why some people who have endometriosis have more intestinal symptoms as opposed to menstrual symptoms. I hope that makes sense. Now, the third reason why it's so hard to treat endometriosis is because so oftentimes women have painful periods or heavy periods, and then us in gynecology or in the other doctors will give birth control pills, which helps stabilize the lining of the uterus, but it doesn't actually treat the root of the problem. And so many women are actually looking for birth control also when they're in their childbearing years, and so then they use birth control pills as a method to control the discomfort and the pain associated and heavy periods associated with endometriosis, but also as a method of birth control, which is totally fine to do. But because birth control pills can sometimes do such a good job at treating that, then we almost mask the symptoms of endometriosis, and then we never get to the root cause while that inflammation is still progressing. The fourth reason why it is so hard to treat endometriosis is kind of what I alluded to earlier, is that the gold standard for doctors to make the diagnosis of endometriosis relies on surgery. It actually relies on putting a camera, a laparoscope, into your abdomen to take a look around to see if they can see any kind of endometrial implants. Now, oftentimes as gynecologists, we will do this surgery and we take a look around and the pelvis looks pristine. There's no implants anywhere. There might be some areas of fibrotic tissue which look like a little bit like scarring, but the patient will have really terrible feelings and pain associated, but the pelvis doesn't look like it does. It doesn't mean that that patient doesn't have endometriosis. Sometimes upon sampling, if we take a sample of those fibrotic areas, those mildly kind of inflamed areas, they will show not endometrial or endometriosis implants, but they'll show inflammatory fibrotic tissue that to us, now that we understand endometriosis, makes a lot of sense. It could have been that those were endometrial cells that your immune system has already processed. And if they've already processed it, then the leftover is scarring. Oftentimes we'll go in and take a look around and there's scar everywhere. And we're like, wow, there's so much inflammation here. We take samples, and maybe not all gynecologists will know is that when the pathologist looks at the cells, sometimes there are endometriosis cells there and sometimes they're not. It just depends on what phase of a woman and when that sampling occurred, because those cells might have already gone through immunologic processing through your own body's healing properties to help heal any kind of inflamed area. So it's unfortunate because a lot of times our gynecologic diagnosis relies on surgery. However, it doesn't necessarily need to be that way. And actually in 2019, the American College of OBGYNs has actually created a call to action that maybe we need to be looking at the way we diagnose endometriosis instead of a surgical diagnosis, but more of a clinical diagnosis. I completely agree with that. I think that is the best way that we're going to help women, so that we don't put a scope in and take a look around and feel like, man, there is no endometriosis, or maybe there is or not. Maybe what we're seeing doesn't make sense. But it's really important to diagnose this clinically, to not have to put women in front of the risk of surgery. The final reason why it's so hard to treat endometriosis is because there is so much really great medical technology that helps women with the symptoms of endometriosis, but it doesn't treat the cause. And so some of those medical therapies include GnRH agonists or antagonists, which are medications and injections that block the signaling of something called GnRH in our brain, that actually changes the pulsatility of those signals to your pituitary gland that causes ovulation. And so if you block ovulation, well, then you're not going to have the ebbs and flows of estrogen that cause a lot of the bleeding that come with menstruation. But it doesn't treat the root cause. And that's also why many women who are on different hormonal therapies don't receive a lot of relief, because just because you're blocking the menstrual cycle doesn't mean that you're reducing the gut inflammation that brought people there. And that's really important to understand. And as women are guiding through and navigating through the really challenging information that is out there to treat endometriosis. I hope that you found this video helpful. I think that it's not only hard for patients, and actually it's one of the biggest reasons why people start to lose faith in medical care and gynecologic care, is because endometriosis is so different for everyone. But what we are learning is that the gut microbiome has a huge impact in how we treat endometriosis. And I would love for you to stay tuned. We are going to have another video on exactly a lot of the nutritional factors that will be involved in helping, one of them being vitamin A, that I'm really excited to do. So go ahead and click subscribe, like, share with a friend, and we'll see you at our next video.